Hi there, I'm Coby Langford, osteopath here at soothe.com. Welcome to my clinic. I thought it might be nice to start this video by showing you how I've transformed my treatment room into a studio because today is filming day. And I have just spent a couple of hours answering all the lovely comments and questions that you leave on the videos on this channel. And some of the questions require an answer that's a little bit more in depth than I can give by writing. So I thought it might be nice to do a little Q&A video where I can just give you some answers that you can really utilize and integrate into your life. So shall we head over to my studio, which is 1 meter away from my desk, and get you some answers. Okay, so the first question is from someone called English Experts. Excuse me, I believe my psoas has shortened and this is causing my bulging disc, especially while sitting. How do you recommend I stretch this? So psoas is a muscle, a little muscle, I'll put a picture up now, that goes from the lumbar spine all the way down to the front of the hip on the femur. I don't personally believe that a tight psoas would cause a disc bulge. I don't think there's any research to prove that. What we do know is that a tight psoas would cause expedite degeneration in the discs, because any muscle that's tight, what that does is it pulls the joints closer together, and when joints are pulled closer together, it basically means they're grinding together, and that can accelerate, that's the word I'm looking for, degeneration, and it can cause gentle extra pressure through the disc. So to sum that up, I don't think a tight psoas has caused your disc bulge, but it may be maintaining it, if that makes sense, because the discs need to decompress to allow the bulge back into the central position. There needs to be lots of space. So stretching your psoas is absolutely brilliant way to care for your discs and help the rehabilitation of a disc bulge. So the best exercise I know for psoas is a position called the runner, which I will show you now. So this is the posture known in yoga as the runner. It is literally one of my all-time favorite exercises. It's absolutely brilliant for low back pain because a tight psoas is incredibly linked to low back pain. So starting in this position, if you can, just move on to all fours, and we're just going to bring the right leg between your hands there and shuffle that back leg back as far as you can. I know you may not be able to get this far, so if you can't, you can just do this here as well. Okay, so you can modify this to your personal abilities. Okay, and from here, always contract the core. Okay, contract your abdominal muscles, your lower abdominal muscles, and then raise up into this position here. Now in this position, and then you sink down, the weight straight down here. Okay, don't lean forward, don't just weight straight down and just gently sink down into that. Now you are stretching this left psoas here, the psoas of the extended leg. Okay, so you can stay there, and if you want, you can just, what some people like to do is just gently rock up back like this if you're just targeting psoas, and then rock forward. There we go. If you have got lots of mobility, you might like to do something like this, where you just clasp the hands behind, roll the shoulder blades back, extend the head up towards the ceiling, just to get a nice upper back compression stretch into there, opening up the pectorals. All good to multitask while you're stretching out your psoas. I also love to do some neck stretches while I'm in this position. Definitely going off course here, but just showing you how you can really use this exercise to help the whole body. Okay, and then coming back, hands down either side of the knees, bring that foot back, knee back. Always good to do a counter pose to this, which is to bring the head down into child posture. You might want to separate your knees and just let the chest drop down towards the floor there. Okay, always do the counter posture, and then just the other side. So bring the left leg forward. Here we go. And I'll show you the modified version, so you might just want to do it to here. If you've got tight psoas, you're likely to only be able to get to here, and then you just sink down. There we go. Now what a lot of people do wrong in this exercise is they bring the knee right over there. Now in that position, you are going to strain the knee and potentially the ankle, so just make sure that as much as you stretch, your knees always directly in line with your ankles. Really important, okay? So just sink down into that, drop down. Again, nice neck stretch while you're there. Breathing nice and gently. If you want to, just extend that. Clasp the hands together. Shoulder blades roll together. Head back. Open up the chest. And that just really, all the time, really focusing on psoas. Okay, I'll keep the relax while you're stretching psoas. You do need to relax the abs, okay? So that you can actually get directly into psoas. Normally when you're doing the runner, you wouldn't really relax the abs, but for the purpose of getting to psoas, we're going to do that. Okay, so and to come out of that, contract the abs to come out of this. So the abs do the movement. Hands down either side of that front foot. Bring the left foot back and drop back into that counter pose there. Lovely. Separating the knees and drop down. To come out of that, when you're ready, you might want to stay there quite a while. Just gently walk your hands towards you and back to the central position. Okay, so that's it. Nice and simple, incredibly effective, and is actually good for disc injuries as well, because if you have a backwards bulging disc, this is great. It's in a nice extension posture, will help to gently encourage that disc back into the position. Okay, I hope that helps. Enjoy. Okay, so the second question comes from somebody called Yuan Alcantar. Hello, Yuan. I have a bad disc in my upper back. At the end of the day, after a long day of work, I get spasms so bad it feels like I'm getting stabbing in the back. It is so painful. On smiley face, tears. Okay, so Yuan, this is a really important thing you brought up here. Back pain at the end of the day in the upper back after a long day of work. So my approach to this is the reason you get back pain at the end of the day is because muscular back pain is caused by tension build-up. Okay, so at the beginning of the day your muscles are at a certain tension, and then you sit and you sit and you sit all day, or you don't move, or you lift heavy things, and so the tension builds up until you reach what we call the pain threshold, a certain tension level of muscles at which point you feel pain, and beneath that point you don't feel pain. So my approach to this is, if you can do some stretches in the morning targeting those muscles in your back that you experience pain, because everyone has different weaknesses, so everyone experiences pain in different areas. So if you do a few exercises, stretches in the morning, and then maybe a few at lunchtime, and then a few in the evening when you get home from work, what you're essentially doing is just unwinding that muscle tension and keeping it below the pain threshold. So that's the best way to, you can do some exercises once you're in pain and you've got that stabbing pain, but my approach is always preventative. So let's make sure you don't get to that point of pain in the first place. So in response to this, I think it would be great. I'll do a video of maybe a few 5-minute morning program you can do before work, maybe a few stretches you can do at the desk, and a 5-minute program for after work. So I'll try and shoot those in the next few weeks for you. Okay, so the third question is from Amal Bikale. Hello, Amal. Facet joint tropism, L4, L5 and L5S1, please give advice. Okay, so facet joint tropism, essentially the outcome of that is degeneration, accelerated degeneration at the facets. So my advice for that is keep it mobile. Keep the muscles in the low back stretched out so you've got as much space between the facets as possible. Also, keep your core stability active so that you're stabilizing the spine as much as possible. When you have this kind of asymmetric positioning, you can wear the surfaces of the cartilage of the joints down quicker than usual. So again, getting the right exercise program for you is absolutely crucial to managing that situation. When I was at university, we were taught that yoga, or the right stretching program, the right gentle relaxing yoga like Drew yoga can actually really, really prevent arthritis and degeneration of the spine and all the joints of the body. The number one dangerous thing you can do for your body is to allow it to become tight and stiff and immobile. You then get reduction of blood flow, you get reduction of drainage of wastes, you get reduction of delivery of oxygen everywhere. Your body becomes like a stagnant pond rather than a beautiful flowing river full of nutrients. That's a really good analogy that we were always reminded of at osteopathic college, because the body is a living organism, obviously, but it needs that. It needs delivery of oxygen, it needs drainage of waste, it needs to be able to move. And when you allow that to stop happening, that's when the body starts to cause you pain and to degenerate. So really easy way to very intelligently look after facet tropism as much as possible. Obviously there's a limit to what you can do, but that is, I believe, one of the best things you can do. And the last question from Saeed Fatih. Hello, Saeed. This was left on the 3 magic exercises for sciatica. How can I do this exercise when I can't move from sciatica? So that's a really good question. And actually, I'm answering this because a few of you have asked this. I've had so many people in the last 2 weeks, really bizarrely, say, I can't get anywhere near that exercise. So firstly, I did shoot the video with the modifications, so to show you how you can do them if you have sore knees. But if you can't move from sciatica, first of all, you must get a diagnosis for your sciatica. Sciatica is not a diagnosis, it is a symptom. I'll say this to the day I die. So you must see a physiotherapist or an osteopath or a chiropractor and get an absolute definitive diagnosis. It is always possible to move. The only time it's not possible, I imagine, is if you have an active disc bulge, in which case the exercises in that video are not appropriate for you, because they are for piriformis syndrome and tight gluteal muscles. If you have piriformis syndrome and tight gluteal muscles, you absolutely would be able to move into those. So to answer your question, if you can't move and get into those exercises, then you should be under the care of a physio or an osteopath getting treatment every day. So that's my answer. If you can't move and get anywhere near those stretches, you need to get yourself an amazing therapist that you trust and enjoy working with, and just have a strategy and a plan for getting resolution to that sciatica, and eventually they may prescribe those exercises for you as maintenance. All right, my friends, I really hope this helps, and keep sending me your questions. I love answering your questions and helping you in any way I can. Have a great day.